Sio Nagadagu Ayageha Julie Sewer Daguado Gale Iliga Hani Ojedaha. So hello everyone, my name is Julie Seward, as I said earlier, and I'm overjoyed that we've all come together. So I am a proud citizen of Cherokee Nation and excited to have all of you here with us today for our R&R meeting, our Reflect and Regroup. So this is really an opportunity for us to kind of come together, give updates on all the work that the Native Oral Health Network is doing and all of our partners, and to connect and network, and just to kind of be in community with the work that we're doing, because there's so much alignment and overlap and so much support that is needed working in this space. So just some outcomes for today is really just, like I said, just kind of giving an update on our project's activities. We get to hear from Society of American Indian Dentists, which I'm so excited to hear about from Janice and Mary. And then we'll also have an opportunity to share ideas, some feedback, and obviously connect with one another. Okay. So I'm pretty sure you guys are familiar with kind of who we are, what we do, but I know Robert's kind of new to our meeting. So we'll give just kind of a quick overview. So the Native Oral Health Network, it's a program that's housed at the Southern Plains Tribal Health Board, Oklahoma Tribal Epidemiology Center. And so I'm going to say SPTHB because it's a little quicker. It's a nonprofit organization based here in Oklahoma, or based no longer in Oklahoma City and Tulsa, but based in Oklahoma City, Oklahoma. And so the Health Board was established in 1972 to provide a unified voice on tribal public health needs and policy for the 44 federally recognized tribes located in Oklahoma, Kansas, and Texas. So NOHN's mission is to build healthier Native communities by connecting oral health to overall health and wellness. And we do that through peer support, collaboration, and community engagement. And so since NOHN's inception in 2017, we've grown to roughly 200 members nationwide. We work with other area Indian health boards, tribal epicenters, dental support centers, and other public health partners to advance oral health equity for the American Indian Alaska Native population. So this is our team, our staff with the Native Oral Health Network, small but mighty. I'm obviously the Oral Health Programs Manager, as introduced before, and Amanda Yaneza, she's not able to be with us. She's actually completing her doctorate and her coursework, and she's studying for exams and tests and getting ready for her dissertation work. So she's taken some days off to do that. And then we've got Alex Holt, which is our epidemiologist on the team. Okay, so at this point, I'm going to hand it off to Alex, and she's going to talk about some of the data projects that we're working on.
Hi, everyone. Yeah, so, oh, it looks like, Julie, there's a, oh, never mind. Okay, there was like a black screen.
Oh, okay. Okay.
So yeah, so some of the projects that we've worked on and completed, and ones that we are working on. So the Oral Health Challenges and Potential Solutions Survey, this was for Oklahoma only. And we have a qualitative data brief, which is the personalizing oral health care document that you can see a snapshot right there. And then our quantitative results are in the other infographic off to the side. And this was just assessing both tribal and general populations of Oklahoma on some oral health attitudes, and seeing, if community members had any suggestions or, experiences that would better help us understand the current oral health climate of Oklahoma. And then we have a literature review that is almost completed. It's an American Indian Alaska Native representation in the oral health workforce. And this is one of Amanda's projects. And it's looking at dentists, dental therapists, dental hygienists, dental assistants, and just it's a meta-analysis of all of the literature that's out there just regarding American Indian and Alaska Native representations in these professions, and that should be out I think by the end of July, if not sooner, and we will send out a notification through our listserv letting everyone know when that is available to read. And then the next slide.
Yeah, before the next
Oh,
slide,
yeah.
Alex, yeah, I just wanted to clarify a couple of things. So the survey, that work was funded through the National Indian Health Board, and it was through their grant, dental therapy outreach education, and dental therapy outreach, and I think that's what it said, dental therapy outreach and education. And so while it was more than dental therapy, it was really just to kind of get an idea, like Alex said, just kind of like a benchmark, and just see what some of the attitudes and perceptions and beliefs of kind of the general community, more of a like a consumer based, more of a consumer-based survey on dental therapy and access. And so I wanted to just kind of clarify that. And then in terms of like with the literature review and the workforce, this is kind of like one piece of a larger puzzle in terms of workforce that we're really focusing on. So this is kind of the first phase, is really doing this literature review and getting an understanding of, and I think we all know that American Indian and Alaska Natives are underrepresented in the oral health workforce. But this is just kind of laying the foundation for us to kind of build more on workforce. And so I wanted to kind of also kind of give that added clarity, and to kind of like, okay, this is one piece of kind of some more work that we're going to be getting into. And we'll talk about that here in just a little bit. Okay, there we go. Okay.
Okay. Yeah, and so one of the new data projects that we are working on that kind of encompasses this literature review as well, or conducting like a literature review, is the American Indian Alaska Native Racial Misclassification Project. So this is going to be funded through the Oklahoma Shared Translational and Clinical Resource. It's OSCT.
Yeah, Oklahoma Shared Clinical and Translational Resources.
Okay. Yeah. I think I got, I got some of the words mixed up, but but anyway, so yeah, this is going to be a 3-phase project. So we're starting off with a literature review, just seeing what information is out there currently, and then we'll be using Oklahoma as a case study, looking at different databases and that's available for our area that encompasses racial classifications, and kind of looking at it with a more critical eye, seeing what can be improved, and what kind of data is out there for American Indian Alaska Native or health data. I don't think this is specifically oral health. Is that right? Or are we specifically looking at oral health?
No, it's not specifically oral health. So let me just give a little bit of background on kind of what initiated this project. I mean, obviously this is not anything new. This is something in our communities that we that we have dealt with and faced for years. And so this all started with multiple presentations, like you guys have experienced as well, multiple presentations and data where we're, it's statistically insignificant, or we're lumped in the other category. So after kind of asking questions and trying to understand in a more intentional way of kind of like how this happens, like from start to finish. And when I say start to finish, I mean like, at the clinic, at a health clinic or in the community or whatever, and then how it gets reported out you know, at the state or national level, when we're talking about race and ethnicity. And so to kind of get a better understanding of how that works and how it gets to the othering, right?
Oh, we may have lost her. But I'll pick it up. Yeah, so this came from just kind of a frustration of the othering and wanting to know, you know, where is the data? Is it being collected? How is it being collected? Is, you know, when conducting, you know, these data research and things like that, is American Indian Alaska Native an option? You know, other things like that. So, oh, okay. I will pull up my copy of the slides. So sorry about that. I realize that moving is kind of hard on the Wi-Fi. Okay. Let's see. Can everyone see that? Okay, great. Anyway, and so this project is kind of just looking at this, and we'll have more information at our next R&R, our next quarterly one, which we'll give the date for that at the end of this presentation. But let's see. So some other publications that we've had, some guides and publications. We have our first and second edition of our resource guide. This is mainly for the Oklahoma City area, which is Oklahoma, Kansas, and Texas, but we do have resources from other areas, such as I believe the Benjamini area, which is Wisconsin and Michigan, I believe, and then just some national resources that are available too. Then we have our oral health among American Indian, or oral health among Indian Health Service Oklahoma City area population, and this was just a review of all of the current data that was available in regards to American Indian, Alaska Native oral health. The data came from IHS surveys, and we used NHANES and CDC data to kind of compare our area and IHS nationally, and how everything kind of looks at a national level, so general population of the US, and then also some data was available for the general population of Oklahoma. So we looked at that as well. And then we have our oral health policy brief. This was authored by Julie and Michelle Dennison with the Oklahoma City Indian Clinic. And this was through the same grant as our survey, so the NIHB's dental therapy education and outreach. This has actually been also published in Frontiers of Oral Health, I think, is the journal. I can put the link to that as well in the chat. But this is kind of looking at the same things that our survey was looking at, so barriers to oral health, possible solutions, and making suggestions on some policy changes that could be beneficial. We also have our member engagement guide. So this is just looking at the Native Oral Health Network and what we do, who we are, how we're set up, and kind of gives a better idea of what you can expect from being a member. And all of these are available on our website, which I will also link in the chat as well. And there is another publication that's coming soon. This is a dental therapy toolkit for Oklahoma. This is through NIHB's, the second year funding of NIHB's dental therapy education outreach. And this is a toolkit. And we gathered data from a variety of sources, summarized everything, and essentially what you can do with this toolkit is if you are advocating in your area for expanded dental workforce, or would just like to know more about it, you can go through this toolkit, and the sections of this toolkit can be spliced separately. So each individual page of this toolkit can be used individually or in conjunction with another, just to be able to share information on dental therapy and how it can be implemented in different areas, and what different populations can benefit from an expanded dental work. And then, so we did have one presentation this quarter. This was through the Southern Plains Tribal Health Board's Tribal Public Health Conference. That was on April 20th. And we, our presentation was leveraging partnerships to increase American Indian and Alaska Native representation through data. And we kind of just talked about some of the projects that we did that I just previously mentioned. So data analysis, surveys, the American Indian Alaska Native representation in the workforce, things like that. And if you would like to see the presentation, I can work on getting a link to the recording or just sending the slides.
Okay, I'm back on.
Okay, great.
New Wi-Fi, still kind of getting the kinks worked out in the house, so apologies for any inconvenience. I think I was still talking for probably several minutes after I realized it was out, so so that's, you know, that's fun. So I don't know where I left off, but I was probably rambling anyway, so it was probably a good thing that the Wi-Fi cut me off. Okay, so I want to talk a little bit about our steering committee meeting that we always meet the month before our R&R meetings to kind of connect and to kind of reevaluate before we share out and connect with the larger Native Oral Health Network group. And so I know Monica wasn't able to be on our call, but Monica McKee, she's the Oklahoma City Indian Clinic dental director, and she represents the Native Oral Health Network on our CMS work group. And so the CMS work group is a part of a national, or a group that is representative of different national organizations that was it's facilitated by OPEN, which is the Oral Health Progress and Equity Network. And so Monica McKee is our representative for this group. I don't think they've met. They meet quarterly, and I don't believe they met last quarter. And I think they're trying to schedule the next meeting. So there's probably not much to update here. But I will say this has been super beneficial for our networking and partnerships and stuff. And I do want to say that to everyone here, if there's anything that we can take back to CMS through Monica, if there's any questions or concerns, please reach out to me and let me know, and I can kind of funnel that to Monica, and she can make sure that gets put on the agenda for these meetings. So, and then we do have some vacancies for our steering committee. What we're trying to do, since we've expanded and grown, we're trying to have a steering committee member from each of the IHS service areas. And so Ticey and Miranda Davis, who was not able to be on here with us today, they represent the Northwest area, and Allie in Albuquerque, and see, I think we're looking for Great Lakes region, and Great Lakes, Bemidji, and a few others. So anyways, if you're interested, it doesn't matter what area you're from. If you're interested, let me know and reach out, and we can talk further about that. And so during that meeting, we kind of just again talked a little bit more in depth on some of our work and activities, and we also kind of came up with some recommendations and idea and brainstorming for workshops and webinars and training. So we're kind of working through those and looking and planning for that for the next year. And we also have our NOHN video, which I'm super excited about, and I'm going to actually have a little preview of that to show you guys today. So I'm super excited. And so we kind of worked through that inter-steering committee meeting, providing some feedback and kind of wordsmithing some of that. So that was also discussed in this meeting. And then there was a suggestion, I think it was you, Tycee, that that providing a platform opportunity for members or even non-members to like share your story in terms of an experience with accessing oral health, or really anything in terms of oral health, and something that would be beneficial for everyone to hear. So that's something that we're going to incorporate into our new member applications, is an opportunity for people to share their story if they have something in when we have our new webpage, which I'll talk about that here in a little bit. You know, we can kind of share those stories with everybody, and also we'll have that feature on our new webpage too, where they can where they can also share through that platform as well. So that's really about kind of a high-level overview of what was discussed in the May meeting. Okay, next slide. Okay, thanks. I do want to highlight some new partnerships over the last quarter, maybe 6 months. So we are now working with, and I do, let me preface with because of this platform that we've created, the Native Oral Health Network, this has really kind of helped to kind of spur these partnerships and kind of grow this work. And so I want to make sure that we highlight that here. So we're going to be working with the Tribal Impact Consortium, and they're out of Meharry Medical College. And the two main contacts through that group is Dr. Kendall Brunet and Dr. Patricia Matthews-Juarez. And so we're working with them on the Community Health Aid Program assessment and planning project or grant, as the that's long for CHAP. So as CHAP is being expanded to the lower 48 from the Alaska CHAP program, we're doing some assessment and planning and looking at our area. When I say our area, Oklahoma, Kansas, and Texas, even though I think other areas are also looking at the same. Except for the Northwest Portland, I think their Northwest area, they're actually in the implementation. And then I believe also maybe Billings area as well. So we're really excited to be working with them. They work with a lot of tribes in Oklahoma as well, and I believe in other areas. And then we're going to be partnering with Dr. Joseph Solomon from Seneca Nation and University of Buffalo in New York, and through their Native American Pre-Dental Student Gateway Program. And so we're super excited that there's been, I think there's 3 applicants from our area, from the Oklahoma City area. And so we're super excited to be able to have the opportunity to sponsor and support those students attending this program. And I believe it's already started. I think maybe today was the first day. This is over the summer. And so, so it started, I think they do online coursework for the month of June, and then they actually travel to New York for the month of July, I believe. So we're really, really excited. This is something new for us, and we're looking to expand this. We would love to expand this. And Janice and Mary, I'm looking at you guys for that, and something that we can talk about in terms of expanding this program and looking at how we can kind of how it translates maybe in other areas. So also, we're going to be working with Oklahoma Policy Institute, which is a new partnership through our policy brief that was published. And so that really just kind of consists on really expanding the outreach and education piece of that grant and working with them. So we're super excited about that. And the last thing I wanted to mention is if you all, well, number one, if you're not members of OPEN, which is the Oral Health Progress and Equity Network, you most definitely should be. Alex can put in the information in the chat. It's literally just a username and password to sign up and be a member. There's no cost. It's a great community to be a part of. But they are going to be starting to release some funding opportunities, but you have to be an open member. So make sure you're an open member and then check out this funding proposal. Right now they're just trying to look at different organizations that they could partner with in writing and submitting a grant specifically through the umbrella of bringing care to communities through virtual dental homes. So take a look at that. I believe the Google form is not like an application. It's just like learning more about your organization and kind of what you do and who you are. So so first thing, be an open member, and then take a look at this and see if it would be something that your organization is interested in. Okay, next slide. Okay, and I don't want to spend too much time because I want to hand it over to Janice to talk about SED, but and I'll just say, maybe let's just put this into the chat box. If you guys have any thoughts or ideas about these 3 questions, if you could put them into the chat box, that would be great. So the first one is specifically for if we have anyone that's with any Oklahoma tribes or tribal organizations, but if you have any resolutions that encompass oral health, we would love to take a look at those. And if you wouldn't mind sharing those resolutions, just so we could kind of have an idea. This helps us with our training and advocacy, and just kind of having an idea what tribes are, what resolutions have been passed by different tribes. So if that applies to you, then send me a private message or send me an email. The next thing is, so for the next 5 years of our work, NOHN, we're going to focus a lot on like internal evaluation and process improvement strategies and how we can do things to kind of, I guess, this will kind of go into and align with our strategic plan. So, so with this evaluation process, like I said, internally, but also with our network members, with our national members, so how we're building this framework right now. And so I'd love to hear any feedback or thoughts or ideas as a network, as a group, what that evaluation process could look like, and what are some of the things that you think would be helpful. So I know that's kind of a loaded and question and really high level, but if you have any thoughts, and please just reach out to me or put those in the chat box. And then yes, in-person NOHN Summit, I would love for everyone to get together and so no, we're kind of playing around with that idea too. Okay, so next slide. So if you guys just put that in the chat box, that would be great. So things that we're going to be working on, it looks really this summer, early fall, updating our NOHN charter. Strategic planning session will happen July of 2022, and then our new NOHN page will launch also in July 22. Next slide. Okay, this is a 30-second video. Let me show this to you guys. And then I'm going to hand it off to you, Janice. Okay, can you guys see that?
Yes.
Okay, Alex, interrupt me if you can't hear it. I want to hear it play, okay?
Oral health plays a key role in the overall health and wellness of our Indigenous communities, and yet many of our people aren't getting the care they need. That's why we created the Native Oral Health Network, to address these inequities and improve oral health outcomes for Native families. We provide a platform for shared resources, peer support, and community engagement. Your participation makes a big difference. To learn more about becoming a partner with the Native Oral Health Network, call us or visit us online.
Did you guys see that?
Yep, it looked and sounded great.
Okay, awesome. Yeah, so we're super excited about this. This is going to be promoted through Good Health TV, and CAP Marketing is also going to be doing kind of a social media push. And so I think this runs for like 3 months. And of course, we'll be sharing it with all of our partners and on our webpage and stuff. So anyways, I wanted to give you guys that preview. And so now I'm going to hand it over to Janice with Society of American Indian Dentists.
Well, thank you so much. And thanks for all of this. I took so many notes. There's so much that you all are doing, and it's really great work. So thank you for sharing all that you're doing and helping us understand all that you're doing out there. And so, and where we might be able to be involved, it seems like there's a lot of places that there's some nice overlap and some opportunities to work together as we go forward. So thank you. And thanks for having us. And Mary Altenberg is here too. And I want to invite Mary to jump in anytime as we talk a little bit about SED and what we do at SED. So Mary, feel free to correct me at any point in time. And I'm Janice Morrow. I am the Executive Director for the Society of American Indian Dentists. And Mary, I think we've decided on Organizational Development Director for the organization, and she has been such great help in helping us grow the organization. You know, SED has been around since 1990, 32 years, and it's been a very small but very mighty organization. But there are certainly things within a small, tiny organization that we haven't done. Like, for example, we hadn't really been seeking grants these previous 32 years, and it has been mostly volunteer driven and been amazing. This organization has done so well on a shoestring budget, and now we're realizing that there's more opportunity and more things that we can do as an organization. And so Mary has come in to help us sort of build that platform and help us grow in the right areas and make sure that we have all the ducks in a row in order to do a lot of that new work. And so I'm going to share my screen. I just have a few slides to share with you. Nothing really super exciting in terms of slides, but at least a little something to share with you here. Let's see. Okay, so SED is, as I said, a small nonprofit organization, represents the needs of American Indian dentistry for both professionals and for students. Our mission really is to promote dental health in the American Indian community, promote American Indian heritage and traditional values, and support the unique concerns of American Indian dentists. And so we do all of those things through a variety of different programs and resources for our membership. But our greatest purpose in all of this is really to encourage American Indian youth to pursue a career in the profession of dentistry, regardless of what that means, from all levels of dentistry. We want to serve as a resource and it's for assistance for American Indian students who are interested in a profession in dentistry, and then also provide role model leadership. And of course, we do this in a number of ways. The scholarships for pre-dental and dental students, as well as residents, that's something that we do quite regularly. Every year, we have a number of scholarships available to our students. And this year we've really expanded. And I think that our typical scholarship total for the organization is going to be around $50,000 a year. So I think that's a really great thing that we've been able to do, is just really increase those scholarships for students. And certainly there are IHS scholars available, and there are many others available as well. But we realize too that our students, especially pre-dental students, are really finding there's some other places that we need to be helpful to our students. And so one of those areas is with the DAT. So something that we started in 2021 is a DAT program for students, is really to bridge that gap from undergraduate to dental school. And so we started that in 2021. To date, we have 15 students who are somewhere in the process. They are studying by doing the Kaplan course, or they are preparing to take the DAT, or they are applying to dental. This program supports these 15 students so far from in that entire process. And to date, we've had 2 students who have completed their study of the DAT, prepped and taken the DAT test, and then both have been accepted to dental school. So we have 13 others who are somewhere in that process, but I would say we're working at 100% at this point. And both of those students are students who had taken the DAT previously and maybe didn't have a great score on the DAT test, or maybe applied to dental school and were not accepted for one reason or another. So to see those students, in fact, do exactly what we thought could happen with the right study course, not just the content. I think our students are prepared in terms of they've taken the classes, they understand the science, they understand the writing and what's expected of them in the test, but how to take that test is a really big barrier for students that we're finding. And so having to take the DAT test a second time or a third time at $500 a time to take that test, but also in the study portion, the cost of the Kaplan Plus program is significant. And most students, no matter who you are, find that to be a barrier. And us being able to offer that through our DAT prep program has been so far a super successful opportunity for SED and for those students. In addition to the DAT prep program and the scholarships for dental students and residents, we also offer a mentorship program. That mentorship program to date really has been somewhat informal, if you will. It's just an opportunity really that we have found where students link up with one of our professional members, and over the course of their dental school experience or pre-dental experience, they have somebody that they can ask questions to, and just have a one-on-one mentor. But what we have found is that we really needed to expand that program. And so that's something that we are kicking off this year at our conference, is a more robust program in terms of mentorship. And part of the reason we saw the value in that too is that SID has doubled its student membership in just the last 18 to 24 months. So we went from a typical, say, 20 students in pre-dental and dental school to now 47 plus. And just this week, we have welcomed 4 new student members to the organization. And so for us, with us, small membership of around 100 total, to have 4 members join in 1 week is very exciting for us. And we really like that we're seeing that there are far more American Indian students who are finding themselves interested in dentistry than ever before for our organization. So we're excited to report that. Additionally, we offer the annual conference with a student travel stipend. So students get the chance to actually meet in person, learn from, work with, and engage with other American Indian dentists. So many times our students say to us that they want to become a dentist and they don't know that there is another American Indian dentist out there. They have never seen another American Indian dentist. That's not who they visited in their dental program. And that's not to say that that's not happening more and more, but it's just few and far between, because you all know the numbers, about 450 American Indian dentists across the nation, not a huge number out there. And so for our native dentists to engage with our pre-dental students and our dental students, we really feel like is an important component to the work that we do. And so we provide a travel stipend for students to come to the conference each year and really spend these 3 or 4 days immersed with other dentists and have a chance to, be involved and share stories and ask questions, and then also find a mentor within that group as well. So we're really excited about our conference, which is coming up in this month. Actually, I can't believe it's already 3 weeks away. And so we're gearing up for the final stretch here to welcome all of these students to the conference. Now, one of the other things that we do at Society of American Indian Dentists is a lot of outreach. One of our big events, and Allie has been a big part of this over the years as well, that the Dental Support Center has been very supportive of this, is our Caring for Native Smiles outreach event at the Gathering of Nations Powwow in Albuquerque. That is always the last weekend in April. And we've done this for several years, and each year 200 to 300 students, I should say children, are screened at that event. And it is a great opportunity. I mean, we really enjoy doing it because not only do we get to provide those screenings, but we also get to see these beautiful children in their regalia just coming off from competing in a lot of cases. This young lady in the red dress there, she just I think earned a first place, and then came over and did a dental screening. So it's pretty exciting for her. She was having a great day that day. And we do this at other places too. We encourage all of our dentists to do local outreach, whether it is at their local health fair, or whether it's with a powwow or something like that. We do these on the local level, and then we do these other national, bigger, opportunities like the Gathering of Nations. And when we were in Oklahoma the last time, we were at the powwow there as well in June, the Red Earth powwow there. And then we've done a few others over the years as well. And of course, our student chapters, we have actually one official student chapter of the Society of American Indian Dentists at ASDO in Arizona, and they do an annual Give Kids a Smile event too. And I couldn't find the picture quickly, but they get really into it, and they dress up as superheroes, and they go out and do their education event as well. So we are pleased to see our students also participating in these outreach events too. And as I mentioned, last but not least, our conference is coming up in just a couple of weeks. And of course, everyone here is invited. I actually see a few names that are here with us today who I know will be there in person with us. This year, the theme is Beyond the Pandemic, a Time for Growth and Enthusiasm. And we have some great CE planned. It's all on the website if you want to take a look, thesaidonline.org. There's a click for annual events, and then you'll find our 2022 conference link in there. Typically, we do this conference in a city where there is a dental school, and we often draw from that dental school the professors and the experts in the field to provide a lot of the CE along the way. But in planning for this year, this is our first in-person conference since 2019, when we were in Oklahoma City. And so in planning this one, in choosing a location, we were needing to do that a year ago. And because of the pandemic, the dental schools still weren't inviting people on campus. And so we decided to do it in Albuquerque, separate from a dental school location, just to make sure that we had a chance to plan plan accordingly for the year. And so this year it's at the Isleta Resort, just south of Albuquerque, easy flight in and a free shuttle from the resort to, or the hotel, or sorry, the airport to the resort and back. And so we thought that would be an easy way to sort of get everybody stepping back into some in-person events. And in doing it this way this year, our founder, Dr. George Bluespruce, he really challenged us this year to try to bring in experts in the field who all happen to be American Indian, and almost all of our speakers are. And so we're really excited to highlight the work of our own membership and the expertise of our membership, and also people out in the community who are going to share some really great CE. We have 17 hours available to any participants who come. And one of our exciting things that we're doing this year is something that we have never done before. It's a pre-conference session. It's a 6-hour workshop actually called High Chair Dental Care. And that is being provided by Dr. Winifred Booker and sponsored by CareQuest. And so that session, that 6-hour CE session, is absolutely free to anyone who signs up. So we're hopeful that we'll have a few more people sign up, even if you're coming from across the country to participate in this. It's a great opportunity for 6 hours of CE. You go home with a diaper bag full of exciting information and sippy cups and different things that you can use to use the high chair to provide dental education and teach parents how to use the high chair in the home for great oral health care, starting with before the first tooth. And so we're really excited to have that session that's coming up. And if you haven't signed up for it, please consider joining us. It's June 22nd through 25th at Isleta Resort, just south of Albuquerque. And last but not least, here is my contact information. And I think I spoke so fast that I didn't give Mary even a chance to try to jump in. So Mary, if there's anything you want to add, please jump in.
I did put some stuff in chat about, some of those intangible, but just as important aspects of the work that SED does. And also, just to say that this is an exciting time for SED because it has been around for so long, which speaks to its importance and the need for it to exist. But now we have this opportunity to increase the power of the voice that SED can bring to improving the oral health of American Indians and Alaska Natives. And we're thrilled to be part of that. To me, it's just really exciting. And we hope to see even greater growth in the organization and our impact in working with other organizations and partnering like we are today. So that's pretty exciting too.
Yeah, I'm glad that you shared that. And also I was just reading through the chat really quickly, and Ticey, you're right. I mean, we talked on the phone, we emailed, and we talked about we were going to be in Oregon in 2020, and we were unable to be there just because of the pandemic. And so I hope that we get back in just a short time, maybe in a couple of years or so. We have this one planned, and then I think next year we have it almost sure where we're headed next year, but maybe in the next couple of years we'll make it back to the Northwest. We would sure love it.
Did you nearly say Oregon and then switched it to Oregon? Because so many people do that. I heard it Oregon.
I'm not sure, but yeah, we are excited to come back at some point in time, and we won't be there next year, but maybe in the next couple of years.
I have some questions when questions are allowed.
Yeah, please, let's go.
I just had some questions about recruitment and like data, statistics, how many American, I'm asked this a lot. How many American Indian dentists, Alaska Native dentists, do you count First Nations? Is it just American Indian, Alaska Native? And then do you keep track of how many are in the United States per area? Or how do you have any data or anything to find that out? That's my first question.
Well, that's a great question. I wish we had better data, to be honest with you. The data that we have comes from ADEA. And
From idea?
ADEA, ADEA.
Oh,
Yeah,
okay.
and what's on their website. And also any academic papers that are out there. I know what our numbers are within our own membership, but beyond that, unless it's self-identification, it's very difficult for us as a nonprofit organization without access to a lot of confidential data. It's difficult for us to know exactly who's out there and where they are. So our best guess is that there are 450 native dentists who have self-identified to ADEA in one form or fashion over a period of time. Mary,
Dr.
you can probably
Salomon
jump in there.
shared with me that the 8 ADEA's data, and it was from a few years ago, and it was like 14 or 18 or graduates only. I mean, it was so low.
Yeah.
And so then it kind of piqued my interest, like, well, is there recruitment? Where is the data from? And Dr. Salomon, as Julian mentioned earlier, provided me with that information. But how many members do you all have with SED?
Our number hovers right around 100, and it's a half and half at this point. It's half professionals, half student members. And again, the same situation with student members because of HIPAA laws and other privacy. I don't know if HIPAA is even the right word, but privacy at colleges. The colleges can't tell us who the students are, but the colleges can say to students, here's an organization that you should really get to know and get in touch with. They offer scholarships, and that's usually how those students come to us, and then also word of mouth from other students who happen to know somebody in their class or somebody at their school is typically how students come to us.
I was just asked how many American Indian dentists and hygienists we have in our area. And what I have to do is I have to go through our roster that I update all the time and just count based on what I know. Yeah. And we have very, very, very few, I think, under a handful, maybe like 3 dentists. One's First Nations. So I wasn't sure if First Nations is included in SED, or is it American Indian Alaska Native?
Right now it's American Indian Alaska Native. And I say that because that's who our membership, the people who renew their memberships or join, all are US based American Indian Alaska Natives at this time.
Do you know in the port, sorry, I'm hogging it all. I'm like, have so many questions and collaboration, just ideas that I'm thinking of also in our area, because I want to make sure that our American Indian and Alaska Native dentists know about you all. And sometimes I've heard that they didn't. So, I can be a word of mouth, obviously, as well. So I wasn't sure if you could send something to me, and then, I can just, when we update the roster and I know, I can just kind of just make sure that they know about your conference and opportunities. And then also, do you know in the Portland area, are you able to share with us in the Portland area who the membership are? So that way I'm not, contacting them about something they already know.
Sure. I think what I can do is we can work together and figure something out. We're protective, obviously, of the confidentiality of our membership. If they want to be identified, then absolutely, I usually just let them know about you oftentimes too. And I can say that we have one student who is graduating from OHSU this year and has accepted a position in Oregon at a tribal clinic, I believe. And so she'll be starting very soon. Another who graduated last year is working in Oregon as well. Actually, she may be in Washington. And so I think and another who's about 5 or 6 years in is also in Oregon. So we actually have quite a few who are in the Northwest area. And I'll be glad to figure out how we can connect you.
Are those all IHS scholars?
Not specifically. Some may be IHS scholars, some may not be. We don't always even know if they're an IHS scholar. Again, if they have identified
Oh, okay.
those scholarships to us. Yeah.
I probably know who you're talking about because I'm in really close contact with all the dental programs
Good.
quite often, and they provide updates. So that's great. Thank you.
Great. Hi, Dr. Korb.
Hello, I just want to introduce myself. I just recently rejoined SED. I was a member when I was a student, but that's been a very long time ago. And I was in private practice for 21 years, but now I'm with DentaQuest. And so I just wanted to introduce myself. I will be at the meeting coming up at the end of the month. And then also just to mention Beyond Flexner Alliance. I don't know how much everyone knows about that organization, but I recently attended that, and they, Ed Salzberg, who is with, I think he's with Great Western, but anyway, they did a big research project about the healthcare workforce, dental workforce primarily. They just so far have done Black students and Hispanic students. They're considering doing Native American and Asian as well. But one of the things that would make it difficult is the tininess of the population in general. And then they also only, as far as Black students and Hispanic students, they only do those that are, that they don't do mixed race at all. So that will make it very difficult to ever really do the Native American population, because there are so few to begin with. And then there would be so few that would identify as, completely Native American and not any other race as well, because that would actually eliminate me even, obviously. So anyway, I just wanted to make you aware that they're talking about that research, which might eventually help you know some numbers. So. But I'll see you soon.
Can't wait. Looking forward to it. Glad you're coming this year.
Hey, Dr. Korb, I just want to confirm it's Flexner Alliance.
Beyond Flexner, it's, let me see if I can find you the actual website, but it's, beyond, the word beyond, and then Flexner, FLEXNER. Let me see what the actual website is. It's beyondflexner.org.
Okay.
And within that is that study that I was talking about that will show you about the other populations. You can find that link. It's a really good website.
Okay.
But that was recently held in Phoenix, and I don't know if they've named where the next one will be. They have that conference about every 1.5 to 2 years, and it's just basically to advance social mission as well as diversity in the healthcare workforce overall. Dentistry is kind of on the small side. It's growing. It was originally started with just physicians, but it's growing to other disciplines.
Okay, great. Thank you for sharing that. I'm going to look into that.
You're welcome.
Janice, I had a couple of questions too. So do you know of, I know of the Gateway program through Dr. Solomon's group there. Do you know of other programs? Do you, and how does SED work with those? I know, I believe Dr. Blue Spruce started one in Arizona, I believe.
There's a pre-admission workshop that is it's at ASDO, but it's not specific for students to attend ASDO necessarily. Okay. And so it's a health professions workshop. And University of Washington also has one of those health pre-admissions workshop or health professions workshop. University of Michigan has an interesting program, and it is also a summer program. And it is, I think, it combines something to do with DAT, in prepping for the DAT, but it doesn't, they don't actually do like the Kaplan course or a course within that, but they do prepare students. It's not really the post-bac program, it's a summer program, but there are also post-bac programs that are really great too, that are, sort of that in between if you can do a master's program or a post-bac, and a few schools offer those as well. I really like the Summer Gateway program. A couple of years ago, we sent 2 students, actually in 2019, we sent 2 students to Buffalo. They had an incredible experience. One of those students was really kind of, wavering in terms of going to dental school after all, and then attending our conference and then going immediately to Buffalo. He's in dental school. And so, it's, I think was a really good experience, a really good immersive experience to be able to do that and to remind himself why, his interest in dentistry in the first place. That program, which I'm sure Dr. Solomon has told you, they did it completely virtual the last, I think, 2 years. This year, it's a neat hybrid. And I actually think that it makes the program even better to have this preparation for part of the summer as a virtual, and then to bring them in to do some in-person too at the end. And so I think it's going to be a great program.
Awesome, thank you. And then my last question is, so how or do you guys work with American Dental Association? Do you all partner with them in any way? What does that look like?
Yes, sort of. I mean, they're another organization that supports the needs of dentists, and we have a number of our members are members of ADA. A number of our members have also participated in the Idl program, which is the Institute for Leadership and Diversity. And it's actually, I think it's like a 2-year program. And they come out of the program with a project, and it's something that they can implement in their own communities usually. And so we often have members who are in the Idl program. Right now, we have 3 members, for example, that are participating this year. Last year, we had 1, and next year, I know for sure about 1, but I don't know if there are others that have applied to it as well.
Okay, great. Does anyone else have any questions, comments?
Sorry, I feel like I'm hogging everything. Are you familiar with OHSU, how they have, I think it's YEs, how they have that support for medical professions? And we've been talking about the students, and I asked if there's ones for dental, because that has been a huge challenge, obviously, is taking our people off of their homeland and, where they're from, away from their family, and then going to a school and not having that family support. And so they really concentrate on offering that support to make sure that our students from our communities, succeed. And it's hard, it's a completely different world. I have people from back home that won't even drive to the city. And they left college because I come from a town where there's no stoplight. So to even, go to a place it's very intimidating. So I wasn't sure if there's any support systems in place for dentists to succeed. It's a big job.
Yeah, I don't know about the on-campus programs as far as that goes, but I think that's a really interesting idea. I actually like that idea quite a bit. My daughter happens to be looking at colleges right now, and that was something that impressed me most about a college that we looked at just recently, is that they have it's called the FIT program, Freshman in Transition, and they really bring these students together and give them a support system amongst themselves to feel successful from the start. And so why not consider the same kind of in the dental schools as well? But I haven't heard of that anywhere. I don't know that OHSU has something like that for dental students. Oftentimes for our native students, there's one or two students that are at a campus. And so I hope that as that changes, that there's more opportunity for that support, but maybe now's the time for that support when there are only 1 or 2 students at a particular dental school. So that's an interesting topic, and actually something that maybe we should research and explore a little further.
I just think, recruitment is really important, because we definitely have low numbers and we're underrepresented, but it goes so much beyond that. Is when we recruit, we have to make sure that our students are in a successful environment and feel supported when they're taken away and then put into a whole new world and then wanting to go back to work for their own tribe. I just think it, there's a lot to think about with that.
I think you're right on.
Okay, well, thanks everyone for the feedback and discussion and questions. Thank you, Janice and Mary, for being here. And I've learned so much. I've got so many things going on in my head thinking about. So, so this was wonderful. And so just in closing, again, thank you all for being here. I'm going to put up some, Alex, could you share your screen with the last 2 slides?
Yes, 1 second.
Okay.
Mary, you must have been the director when I first started at the health board in 2004. Were you the director in Albuquerque then?
I
Your name
was.
looks familiar. Okay.
I was. I was the first director for the support center then, and I was there in, I started, I think it was 2000. Pretty sure it was 2000.
When the grant started? Yeah.
Yeah.
So then you probably worked with Bonnie and Jeff.
Yep. Yep.
Yeah. Okay. And
Yeah.
everyone retired.
I know.
I'm like, people do that. That's
I
not
know.
fair.
Yeah. Until, Janice dragged me back to the land of oral health. And so I'm very happy being back in it. So they might be happy coming back in a more limited basis.
Okay, so just kind of wrapping up with some dates, which Janice shared the dates for the said annual conference. So I know I unfortunately won't be able to make it this year, but I'm excited to attend next year. We are drowning in boxes and unpacking. I feel like we're going to be doing this for the entire summer. So this said annual conference, and then we have the Southern Plains Tribal Health Board Training Summit. It is going to be virtual, so be on the lookout for that. We've got a bunch of different courses. We're going to be offering CEUs, and so we'll be releasing the agenda probably within the next couple of weeks, I would say 2 to 3 weeks. So be on the lookout for that, and mark your calendars and join us there. Northwest Tribal Dental Support Center and Ticey's group is going to be hosting the, I think the first Indian Country Oral Health Echo. Yeah, so that's super, super exciting. That's going to be June 8th at 12 p.m. Pacific time. Let's see, let me put this in the, in case you guys can make it, I'll put this in the chat to click on that link, June 8th at 12 p.m. Pacific time. And password is Echo for that. So hope you guys all be there. I'm excited for that, and hope to see you guys there too. And then the next R&R with NOHN will be September 1st at 11. I am not sure who we have on the docket for the spotlight, but obviously we'll get that information out to you all as that becomes available. And next slide. Okay, I think maybe everyone here, maybe your members. If not, all you have to do is just fill out this super, super quick form. Like, I think it maybe takes like 1 or 2 minutes. And that just kind of gets you, I promise we won't flood your email. Just kind of gets you on our newsletter and gets you connected with all the stuff going on in Indian Country with oral health and some of our partner organizations and institutions. So there is that in the chat box. I mentioned open, and I think Alex put that in the chat box earlier, but definitely if you're not a member, check them out and learn more about that awesome organization. Our social media channels, be on the lookout for that. And be sure to follow us and like us and all of that stuff. And then if you would fill out the post-meeting evaluation, tell us how we can do things better, differently, and be more clear about things. If we need to switch some things up, always looking to grow and learn from you all. And I believe that's it. Thank you, thank you. Also, just before we sign off, if you all are interested, we have a bunch of known promo items. So any of your community events that you would like to hand some of our stuff out, send me an email. I'm gonna put my email in the chat if you don't have it. And we can mail you guys some stuff if you guys are out doing different events now, hopefully that we're able to kind of do more of that. So just let me know when we can mail you guys some. But I appreciate everyone being here. And have a wonderful rest of the day and in the week. Oh, Ticey, dental meeting 8/15. Oh, is that for Northwest Portland?
Yeah, we have our dental directors meeting on the 15th, and then our annual Portland area dental meeting in person on Tuesday and Wednesday. We have some very interesting topics as well. OCO, is it OCO or OSIO? I always say it wrong.
OCO.
Yeah,
OCO.
they're going to come out and do a conflict resolution, interactive team building training, and we have some other really cool topics. But I have to tell you all, and Allie, going back to in-person meetings, a lot more work. I'm like, whoa, I forgot about this.
Yeah, definitely. I agree. Well, thank you again to Janice and Mary. Thank you guys for being here. Have a great rest of the day and week and weekend, and we'll talk soon.
Thank you so much. You guys take care. Good to see you.
Bye.
Thank you, everyone. Have a great day.
Bye-bye.